morning to all. I am Dr. Kumar, Assistant Professor in Oral Medicine and Radiology Department, Vinayamachi Dental College. Today's my topic is radiographic errors and artifacts. Films with errors should be avoided due to the following reasons. The reason will lead to expose the patient for the unnecessary radiation, wastage of the film and the time, interface with accurate interpretation and diagnosis. This is the reason we need to take errorless radiographs. The stages of taking radiographs, there is a 4 stages we are using for the radiographs taken. First one is patient position, film position and exposure and processing. These are all the 4 stages we are using to take the radiographs. The errors occurs in each stages considered as a radiographic errors. The error occurs during the patient positioning time, that is called patient positioning error. The error occurs during the film positioning time, that error is called film positioning error. The same way the exposure errors and processing errors will occur. First one is patient positioning error. In this category, what are all the common errors occurs during the patient position? There is a first one is radiopaque artifact, blurred image and phalangioma. We will see one by one. Second is the placement error, film placement error. These are all the errors occurs during the film placement. Third one is the exposure error. These are all the errors occurs exposure time. Then processing error, final one. These are the errors occurs during the processing time. The first, patient positioning error. The radiopaque artifacts. There is a dental appliances, filling materials, and then the eyeglasses will appear radiopaque artifact superimposed over the dental image. So how to correct this type of error? All these items should be removed before placing the film. There is a removable partial denture or body piercing or earrings, it should be removed before taking the radiogram. These are all the examples. First one is the removable partial denture, second one is the brackets, the third one is the filling material. So in this picture there is a earring, the superimposed earrings is interfere with our diagnosis. So we should remove the earrings before we take the radiograph. Then second one is the blurred image. Movement of the film or the patient during the exposure time will result in the blurred image. How to correct this image? The operator should explain for the patient remain motionless during the exposure. The motionless patient is the important for the correct this kind of image errors. See, in this picture, this is a blurred image. The picture is not clear. There is a clarity is not good. Next one is the phalangioma. Phalangioma means the patient's finger on the film. The causes for the phalangioma, the patient finger was incorrectly positioned in front of the film. Instead of the behind the film, the patient finger is front of the film. So the finger bone is used to come to the errors. Is how to correct the error means using the proper X-ray holder. That will be the one of the correction made by this, avoid the phalangioma. Then summarize the patient positioning error. There is a 3 types of errors occurs during the patient positioning. One is radiopaque artifact, blurred image, phalangioma. So you need to correct the remove all the RPDs or removable ear piercing or earrings, correct the radiopaque artifact. Then blurred image, patient stays still to correct the blurred image. Phalangioma, using the film holder to avoid the phalangioma error. That is a film placement error. During the film positioning time, there is a error will occur. So what are all the errors? First one is the double image. When the exposed film is re-exposed to the resulting film, we will have the 2 superimposed image. This 2 times exposed to the film. That will cause the double image. There is a 2 images. See in this picture, there is anteriors and posteriors also seen in the same picture. So this is the double image. Next one is the reversed film. Usually the film position, there is a 2 side. One is white color side, one is arrow side. Always the white color side is facing towards the cone. That is the correct method. Sometimes mistakenly the arrow side is placed towards the cone. This type of error occurs. The reversed film will occur. In this radiograph, if we place the reversed side, in this radiograph there is a tri-track appearance is seen in the radiograph. See the picture in the left side, there is a tri-track pattern or dotted pattern is appears. So we should know about this film is reversely placed. So you have to correct that. Next time we have to correct it in proper way. And then artifact, dot artifact. The identification, embossed dot during the exposure time. That time after the developing, there is the embossed dot is a circular well-defined radiolucent area. It will interfere our diagnosis. Then apex cutoff. It will occur when the film is not positioned apically enough to record the entire teeth. X-ray film is superficially placed, this kind of error occurs. The apically is not enough. So apex is not seen. The apex is the very, very important for the diagnosis. Then crown cutoff. There is the same thing. There is no enough film extending towards the occlusally. Only the root portion is seen. The crown portion is not seen. This is also some kind of the error. Next one is the dropped film corner. The film edge is not placed parallel to the occlusal surface of the teeth. It should be very important. Always you should place the film parallel to the occlusal surface. Sometimes it will be, it's not parallel, it will be the film corner is a drop. Area of the interest is not shown. This is the result in the placement error. If suppose in this picture, we need a impacted third molar clearly, but the film placement is not correct. The film is not extended entirely distal to the third molar. So distal side of the third molar is cut off, but we need that area. So the film placement is very important. In this error occurs during the correction of the film placement. So next one is the black line. Due to the excessive bending of the film prior to the placement of the patient, inside the patient. If with the bending of the film, the inside there is a composition of the film, there are silver halide crystals also there. The excessive bending will cause remove the silver halide crystals in this film. So it will cause the black line. Black line is one of the main error. Next one is the distortion. Due to the bending of the film, to eliminate the patient's discomfort, specifically lower premolar and upper central incisors. The one end of the film is bent actually, not the entire film. One end of the film is bent, it will cause the distortion. In this picture, first picture is a normal picture, second one is the after distortion, the end of the film is the curved. This error is called distortion. Let's summarize the film placement error. First is a double image. There is two exposed in the same image. Then dot artifact, the embossed dot actually well-defined radiolucent appearance, crown cutoff and apex cutoff. The area of interest is not shown because of the film placement is not correct. Then dropped film corner, then block line. These are all the errors will occur during the placement of the X-ray film. Exposure error. In this category, there is an incorrect horizontal angulation, incorrect vertical angulation, cone cut, blank image, low density image or light image, high density image or dark image. These are all the errors during the exposure time. So we will see one by one. First is the incorrect vertical angulation. The vertical angulation is insufficient. The reduced vertical angulation, this will be cause the elongated image. Image will be elongated. The vertical angulation is increased. There is a shortened image is shortened. So the correction, how to correct the vertical, the elongation image and shortened image. The correct the elongation image, if the elongated image occurs, furthermore increase the angulation. The shortened image, correct the shortened image, decrease the angulation, will correct the shortened image. So see this picture, there is a elongated image and the teeth is elongated than the normal image. Shortened image is a very short, teeth are very short. Then also there is one more angulation, is called horizontal angulation. Incorrect horizontal angulation also produce some kind of errors. So what is the errors means? There is a wedge-shaped radio-opaque area seen in between the teeth, the radio-opaque areas. It is because of incorrect horizontal angulation. So how to correct this error? This is due to improper horizontal angulation. The proper alignment, the central ray of X-ray beam should be through the contact points, passing through the contact points. So this is the method to correct the incorrect horizontal angulation. See here, first picture, there is a wedge-shaped radio-opaque area in between the teeth. That is the error. That is the incorrect horizontal angulation. Then next is the cone cut. If the position indicating device is misaligned or malaligned, the X-ray beam is not aligned with the X-ray film. That is the reason is the cone cut. The partial image is seen in the radiolucent area. The partial image is appear as a white area. This is called the cone cut. We will see the example of the cone cut. See both the picture. There is only the image is in the partially. The partial image is only the white in color because the cone is not positioned properly. This is always the cone cut. Remember, the cone cut is round in shape because the collimator shape is the round. Beyond the collimator, there is no exposure. That's why the cone cut is always round in shape. Then blank image. The film that didn't receive any radiation, without receive any radiation, without expose the film, you will develop after developing appears as this kind of image. Is mistakenly will sometimes will happen. That's a blank image will occur. Low density image or light image. Light image occurs during the exposure time will reduced. The reduced exposure time usually will give the 0.7 or 0.8 millisecond for the exposure time. If it is sometimes it will be the 0.4 or 0.5 millisecond is exposure time will set, this kind of error will occur, the light image will occur. This is the next one, the dark image. Dark image will occur during the excessive exposure time, because the more than 0.5 there is a 1 second or 1.2 seconds will create that will create the dark image. So summarize the exposure errors. There is a incorrect horizontal angulation, it will occur, and there is a errors is vertical elongation and shortening, and incorrect vertical angulation, it will create the radio opaque areas in between the teeth. Cone cut will occur the malalignment at the position. Blank image, unexposed image, unexposed X-ray film. Low density image, reduced exposure time. High density image, increase the exposure time. These are all the errors occurs during the exposure time. So next one is the processing errors. The processing errors further divided into two categories. One is the chemical errors, the other one is the film handling errors. First is the chemical errors. Under this category, there is also the light image, dark image, reticulation, black spot or patch, white spot or patch, yellowish brown discoloration. These are all comes under the chemical errors. Film handling errors is the developer cutoff, fixer cutoff, smudge and scratched film. So first is the dark image. Dark image occurs due to the prolonged developing time. If you put the X-ray film and the long time, longer than the normal time in the developer solution, it will the dark image will occur. The light image causes due to the prolonged fixing time. Fixing time is prolonged, it will be the light image will occur. Developing time is prolonged, dark image will occur. So reticulation, next one is when the film subjected to the sudden temperature changes between the developer and water. Sometimes it will occur, that's a very rare errors, sometimes it will not occur. That is cracked appearance. The film, see the picture, there is a cracked film. This error is called reticulation. Next is the black spot or patch. The developer communication before you will immerse into the developing solution, some contamination, that some developer solution comes in contact with the film, that will create the black spot. There is a black spot or patch. The same thing, white spot or patch is due to the contamination of the fixer solution before the processing. Before the film processing, there is a fixer solution is contaminated, that will cause the white spot or patch. Then yellowish brown color discoloration. The solution is insufficient rinsing. After the fixing the radiograph, the proper rinsing is important. Insufficient rinsing is it will occur in the yellowish brown color discoloration. So next one is the developer cutoff. The straight black white border due to the underdeveloped portion. The film may not be completely immersed into the developing solution. The film is not completely immersed into the deep into the developing solution. The part of the film is not immersed in the developing solution. So that area is white color appearance. Developer cutoff. Developer cutoff is white color. You have to remind this is not a cone cut. Cone is the developer cutoff is a straight white line. The cone cut is the curved white line. So that's the difference. You should remember that. Then fixer cutoff. The straight black border. The film may not be completely immersed in the fixing solution. Same kind of thing. The fixing solution during the fixer time, the film is not completely immersed in the fixing solution. Part of the film is immersed. Part of the film is not immersed with the fixing solution. That is, that area will cause the black line, black area. So smudge or fingerprint. When the film touched by the fingers, contaminated with the developer or fixed. There is a fingerprint. There is a very common error. Then scratched film. There is X-ray film is coated with some kind of emulsion. That is called coating is called emulsion. Sometimes during the developing time, the film is very soft. So the handling of the film. Sometimes the nail scratching, emulsion peeling. That is called emulsion peeling due to the nail scratch. The film handling is very important. Be very careful. This is the radio opaque artifacts. Some of the material is abnormally white in color. So what is that? This is the metallic partial denture, the RPD. Metal partial denture appears as the very dark white in color. Okay, next one. What is this? It's a blurred image. The image is not clear. See the blurred image. This is an unclear image. Due to the motion, the patient is moving during the exposure time. This one is, see the left corner, there is a clue. There is a tire track appearance. This is due to the reversed film. Always remember the white side of the film is towards the cone side. The arrow side is the opposite side. Okay, if it's a reverse film, the tire track will appear. And next is the apex is not seen, only the crown portion is seen. This is the apex cutoff, the same thing. What is this? So, dropped film corner is not, occlusal film is not parallel to the occlusal plane, due to this error occurs. So, distortion, one end of the film is curved, bending the one area only it will cause the distortion. So, elongation due to the incorrect vertical angulation. Due to the incorrect vertical angulation, elongation is occurs. This is a horizontal overlapping. Incorrect horizontal angulation will cause the wedge-shaped radio-opaque area seen in between the teeth. This is a horizontal overlapping, incorrect horizontal overlapping. This is the next image. There is a two images. See the horizontal one and the vertical one. There is a double image. 2 times exposed the same film exposed by the 2 times. This area error will occur. Then this is the lighter than the normal. This is the image is a lighter image. The light image is, there is a 2 reasons will cause the light image. One is reduce the exposure time. 0.7 seconds is the normal time. Less than the 0.7 second will cause the low density image or light image, and also the processing time, it increase the processing fixing solution. We will put the longer than the normal time in the fixing solution, it will cause the low density image. Next one is a white spot or white patch. It will be the contamination of the fixer solution. I will know that. This is a yellow color, brown or discoloration due to not properly immersing with the water. After the film processing is over, we will completely rinse by the water. That is the most important point. So, is the right track appearance, reverse image we have already shown. These 2 pictures is very, very important. One is horizontal black area, one is the round shaped black image, white image. Yeah. First is the developer cutoff. Developer cutoff is a straight line. Remember, cone cut is a curved line because of the collimator shape is the round shaped. Okay, must know the difference. Thank you for watching my class. Thank you.